All right, guys, like promised, I just wanted to make a quick video in regards to APGAR scoring. And remember, like we talked about in the other sections in the series, we do not provide or we don't use the APGAR scoring as a determiner if we need to resuscitate baby or not. We rather use APGAR scoring as a determination if we need to, or basically how baby is doing, right? How well they're doing. Very similar to how we do GCS scoring in adult patient. Let me see if I can make this just a little bigger. Oops. Okay, so like we talked about, and don't feel like you need to commit this to memory. However, you are going to need to know some of this for your National Registry exam. But this is something that we don't get to do very often, so it's something that you should have available to you. Like most of your commercial OB kits have an APGAR scoring chart on the actual packaging so that you can reference this when you get into the field. Remember, APGAR stands for appearance, pulse, grimace, activity, and respiration, okay? Appearance is their skin color. Pulse is obviously heart rate. Grimace is their reflex irritability, okay? What we're talking about here is if I pull on their arm, do they snatch their arm back into their court, right? Because they don't want me pulling on them. Activity is in regards to their muscle tone, and then obviously respiration is self-explanatory in regards to their breathing effort. We score a patient in each category based on what they look like in each category. Going off with appearance, obviously all zeros are bad. If we have all twos, that's great. Zeros is a baby that is really, really sick and is not doing well at all. Twos is a baby that, or all twos are a baby that is really healthy and is doing really good, okay? Now, usually we want to aim for somewhere of an APGAR above a 6. Initially 5 to 6, somewhere around there. Anything below a 5 or 6 indicates a baby that is really unhealthy or needs a lot of assistance. Anything above a 5 or a 6 on your first APGAR scoring indicates a baby that's on the right track, okay? So looking at appearance, and we'll go all the way down in our 0 points category. Appearance, if we have a bluish gray and or pale, and this is all over their body, they're going to score a 0, okay? Looking at their pulse, if their pulse is absent, and remember this is a brachial pulse that we're feeling, we give them a 0. If they have no reflex irritability, basically they're limp, right? When I pull on their arm, their arm falls over, we give them a 0. And then these two are kind of the one and the same when you think about them in the 0 category. They're not when we move up. But in the 0 category, if their activity, if they're limp and they're floppy, we're going to give them a 0, which would be the same to no stimulation response, right? And then respiration, if they're not breathing, we give them a 0. Moving into a little bit of a better category, in appearance, if their body is nice and pink, but they have blue extremities, this is normal. This is what babies look like when they come out. We're going to give them a 1. If their heart rate is below 100, still not great. Remember, we're going to do what here? That's right, we're going to ventilate them. If it's below 100, and remember this is a brachial pulse, we're going to give them that 1. Grimace, if they have facial movements only, if they'll grimace their face when I pull on their arm or I pinch their foot or whatever, but they're not actually pulling away from that, they're not crying, anything like that, then I'm going to give them a 1. Inactivity, if they have flex limbs, but they're really not moving them around, you know, when you got a good, I guess not a happy screaming, crying baby, but when you got a screaming, crying baby, those little limbs are going all over the dang place, and that would be a 2, but with that, we're just going to give them a 1 if they're just kind of flexed and we don't have a lot of movement with them. Respirations, if they're slow or irregular breathing or they have a weak cry, we're going to give them a 1. And then heading into the 2s, these are the goods. These are where we want babies. At about 10 minutes after birth, we want to see our babies have 2s all the way across the board. Their body color is normal and they have pink extremities. Okay, so they're nice and pink all over their body. They don't have blue extremities. We're giving them a 2. They have a normal heart rate above 100. They pull away, they're sneezing, coughing, crying. They're just absolutely screaming at you. We're good with that one. Okay, that's a good 2 and pulling away from you. Activity, they're active, they're strong, they've got spontaneous movement. Again, this is the happy, screaming, crying baby. And then they've got that nice normal rate and effort, and they've got just that vigorous cry, okay? I'm happy with a screaming, crying baby. Screaming, crying babies might not be happy because they're screaming and crying for a reason, but I'm happy with a screaming and crying baby because that means they're moving air back and forth. That means they got a good pulse. That means they got an open airway. Okay. That means we don't have a baby that's in trouble. Now, when we do APGAR scoring, we want to do an APGAR scoring immediately or about 1 minute after birth. And then we're going to do one at 5 and 10 minutes after birth. Okay. Again, that goes with your normal vital sign scoring, right? We take vitals on unstable patients every 5 minutes. So we want to take one at 1, 5, and 10 minutes after birth. And that is the